All right, so the video you're about to see is a polyp in the uterine cavity. So the uterine cavity looks like a tunnel, and that tunnel should be clear or a little fluffy with some tissue. In menopausal women, we don't really want fluffiness, we just want a clear cavity. But the video I'm about to show you has a polyp in that uterine cavity. Actually, there are a couple polyps, so you see a couple polyps in there. And the instrument that I use to resect the polyp called a MyoSure. Now, what are symptoms of having a polyp in the uterus? You would notice bleeding in between your periods. So it's not your time for your period. You just had a period 2 weeks ago and you're spotting again. Or spotting after intercourse. So spotting after intercourse is one of the symptoms of a uterine polyp or a cervical polyp, a polyp that kind of goes from the inside of the cavity down to the opening, which is the cervix. Other symptoms would be like spotting for 5 days before your period. Your period is not due for another 7 days, and you're spotting until the flow actually comes down. So those are symptoms of uterine polyps. Those are reasons why we go and remove them. And this is a video that shows you a uterine polyp and how I resect it. Okay, 1 second. What you're looking at right now is a polyp inside the uterine cavity. So that's the uterine cavity. My camera is trying to go around it, around the polyp, above it, to try to get past it, to look beyond the uterine cavity. So I went underneath. That's another polyp you're looking at right there. So these are two polyps. That's the bottom of the uterine cavity. And we're looking at the polyp in front of the camera. Still trying to get around it, to go beyond it, to go further into the uterine cavity. All right, that's a clearer view of it. So those are two polyps side by side. You can see one to the right and the other one to the left. That's my MyoSure device that I'm going to use to excise the polyp. I'm going to pull back a little bit for you to see it now. See how it's cutting? It's cutting the polyp away. That's the cutting edge of it. I won't be. Yep, you can see better there as it cuts the polyp away from inside the uterine cavity. You can see we're getting most of it out. And that's the cavity after the polyps have been removed.